National Cancer Prevention Month, reducing risk and supporting the body after treatment. February is National Cancer Prevention Month. It's a time to focus on reducing cancer risk and supporting long-term health. Thanks to the advances in early detection and treatment, more people are surviving cancer than ever before. That's great news. That makes it just as important to talk about prevention and quality of life before, during, and after cancer treatment. When we think about cancer prevention, we often focus on screenings and early detection, and those are essential. But prevention also includes everyday habits that support the body's ability to function, to heal, and protect itself over time. Small, consistent choices can play meaningful roles in overall cancer risk reduction. Healthy habits can help reduce the risk of cancer. Some healthy habits that research consistently links to lower cancer risks include maintaining regular physical activity to support circulation, immune function, and digestion. And regular physical activity can be walking 30 minutes 3 times a week. Also eating foods rich in whole foods, fibers, fruits, and vegetables to support your gut and hormonal health. Reducing chronic inflammation through movement, walking, exercise, stress management, getting adequate sleep, and reducing chronic inflammation by addressing your sugar intake. Sugar intake and inflammation go hand in hand. Avoid tobacco and alcohol consumption. Staying up to date on the recommended cancer screenings are also important. These habits do not guarantee prevention, but they certainly do create a healthier internal environment. Even with healthy habits, cancer still can occur. And when it does, treatment like surgery and radiations are life-saving, but can lead to long-lasting physical side effects. One of the most common and least discussed side effects are internal scars, also known as adhesions. Adhesions can restrict movement, reduce circulation, and interfere with normal organ function. Radiation can further stiffen tissues, decreasing elasticity and mobility over time. These changes may not appear immediately. It may be occurring years after the initial treatment. Survivorship care is an important part of cancer prevention, and preventing long-term complication matters. Unaddressed adhesions and tissue restrictions can contribute to bowel obstructions, bowel and bladder issues, sexual dysfunctions, unexplained infertility, and decreased mobility with chronic pain, sometimes even years after treatment. Supporting the body's ability to move, circulate, and function well is a key part of long-term health. So Clear Passage Physical Therapy complements medical treatment and care for cancer. It doesn't replace it. Clear Passage may benefit those cancer survivors who've had abdominal surgeries or pelvic surgeries, have received radiation damage. Maybe you're experiencing chronic pain or stiffness. You've had bowel or bladder changes, had a bowel obstruction, are experiencing infertility, or you have sexual issues and concerns after treatment. No one should assume that these symptoms are simply something you have to live with. Belinda, one of the co-founders of Clear Passage Physical Therapy, she had radiation to treat cervical cancer. And after the treatment, she had an adhered pelvis. She couldn't move. She was in chronic pain. It was horrible, horrible. That's how this treatment started, was to help break up those adhesions so Belinda could become more functional. When she went to her doctors with this frozen pelvis, this inability to move, she stopped work, her doctors told her, there's nothing you can do. You're going to have to live with it. But guess what? You, nor did she, have to live with it. So February is National Cancer Prevention Month. It means more than just avoiding the disease. It means supporting the body's long-term function and your quality of life. Healthy habits, early detection, and comprehensive survivorship care all play a role. At Clear Passage, we are honored to help survivors to move forward with a greater comfort, with more mobility and confidence, because life after cancer deserves just as much care as treatment itself. If you're interested in talking to somebody at Clear Passage, call us at 352-336-1433 or check us out online at clearpassage.com.